Welcome to This Explainer. Today, we're unpacking one of the most fascinating and, frankly, most critical balancing acts occurring inside you right at this very second: cellular fluid dynamics and IV solutions. Have you ever looked at those clear bags of fluid hanging in a hospital room and wondered how doctors and nurses know exactly which one to use? Well, you're in the right place. We're going to decode the precise science of fluid shifts and break down exactly how different intravenous fluids affect the human body on a microscopic level.
Okay, let's dive into this. Before we get bogged down in complex formulas or specific chemical compounds, there's one golden question you gotta burn into your brain. Literally, just ask yourself, where do I want the water to go? Everything we're gonna cover today regarding hypertonic, hypotonic, and isotonic solutions boils down to this one simple objective. If you can answer this question, you hold the key to understanding the entire universe of IV fluids.
Here's our roadmap for today. We'll start with the body's fluid compartments, meet the electrolytes, and tackle the three main fluid types: hypertonic, hypotonic, and isotonic solutions. Finally, we'll wrap up with the clinical dangers and takeaways.
All right, Section 1, the body's fluid compartments. Let's map out the cellular landscape. Now, what's really interesting about this is, to truly grasp how this works, we need to shrink way down to the microscopic level. Think about the sheer volume of water hiding right out of sight inside you. Water makes up the vast majority of your body weight, but it's not just sloshing around randomly like a water balloon. It's meticulously divided up. Actually, a massive 70% of your total body fluid is intracellular fluid, or ICF. That means it's literally locked inside your body's cells, keeping them nice and plump. The remaining 30% is extracellular fluid, or ECF. That's the fluid hanging out on the outside of the cells.
That 30% of fluid on the outside, the ECF, is incredibly important because it's further split into three very specific spaces. First up is the intravascular fluid. This is your blood plasma inside the blood vessels, and it's what directly maintains your blood pressure and circulating volume. Next is the interstitial fluid. This surrounds your cells and tissues, kind of acting like a middleman. And finally, transcellular fluid. These are specialized tiny pools like cerebral spinal fluid around your brain or the fluid lubricating your joints. Now, this ECF space is exactly where pathological fluid shifts happen. If fluid leaks out of your vessels, it pools up in the interstitial space, causing peripheral edema, like swollen ankles. Or it can shift into those transcellular spaces, creating what we call third spacing, like ascites in the abdomen.
Moving right along to Section 2, electrolytes and the golden rule. Think of these guys as the bouncers of the cell.
Seriously, if these fluid compartments are VIP rooms, the electrolytes are the bouncers controlling who gets in and out. Over on the intracellular side, our bouncers are potassium, magnesium, and phosphorus. They primarily reside inside the cell and run the show indoors. Meanwhile, outside in the extracellular space, we have sodium, calcium, and chloride. They act as the main drivers of osmotic pressure in their own domains, and together they keep everything in a state of perfect equilibrium.
If you're a student, memorizing these normal lab ranges is absolutely crucial. But don't sweat it, we've got some great memory tricks to help lock these into your brain. Let's take potassium, which normally ranges from 3.5 to 5.0. Just remember that bananas, an awesome source of potassium, usually come 3 to 5 in a bunch. Easy, right? For calcium, ranging from 8.6 to 10.5, just think call 911, since 9 to 11 roughly covers that normal range. Sodium sits at a neat 135 to 145, and for magnesium, ranging from 1.3 to 2.3, just imagine a magnifying glass helps you see 1.5 to 2.5 times better. It kind of sticks in your brain, doesn't it?
But out of all those electrolytes, the absolute, undisputed king of fluid dynamics is sodium. Water always follows sodium. Say it out loud. Seriously, make it your mantra. Water just naturally wants to balance things out. So wherever the sodium concentration is highest, water's going to chase right after it to dilute it. This one single rule drives the entire universe of fluid dynamics we're about to explore.
Okay, Section 3, hypertonic. Cells shrink. I want you to think of a hypertonic solution as this very specific, aggressive weather system hitting our cells. The prefix hyper means high. So a hypertonic solution has a really high concentration of particles, like sodium, sitting outside the cell. And because of our golden rule, water always follows sodium. So this highly concentrated environment acts like a massive magnet, forcefully pulling water right out of that intracellular space. Let's move to and see how this builds step by step. Imagine we infuse a hypertonic IV, like a 3% sodium chloride solution, straight into the bloodstream.
Bam! Immediately, the extracellular fluid becomes super concentrated. The water inside the cells senses this crazy imbalance and gets pulled out of the cell to try and dilute that salty bloodstream. Because of that, the cell physically shrivels up and shrinks down, while all that new water moving into the bloodstream significantly increases the overall blood volume.
Clinically speaking, these fluids, like 3% or 5% NaCl, are serious business. You use them for emergencies, like severe symptomatic hyponatremia. That's when a patient's sodium drops so dangerously low that their brain cells swell up, causing confusion or even seizures. The hypertonic saline is used to pull that dangerous excess water right out of the swollen cells. But man, the stakes are high. Because you're rapidly yanking all this water into the blood vessels, there is a massive risk of fluid volume overload. You can dangerously overload the heart and actually cause pulmonary edema, which is where fluid tragically backs up into the lungs.
Moving on to Section 4, hypotonic. Cells swell. Now let's swing that pendulum the exact opposite way. Hypo means low. A hypotonic solution has a much lower concentration of sodium outside the cell compared to what's inside. Because that outside environment is so dilute, it basically provides a ton of free water. And that water pushes its way into the relatively saltier interior of the cell, literally turning our normal, happy cells into plump, swelling water balloons.
Following the physiological steps here, say we infuse a hypotonic IV, like 0.45% NaCl, which you'll often hear called half-normal saline. As soon as it goes in, the extracellular fluid gets very diluted. Now, suddenly, the inside of the cell has the higher concentration of sodium, and remember what we said? Water always follows sodium, so the water rushes out of the bloodstream and floods into that highly concentrated cell, causing it to swell right up.
We use these hypotonic fluids, like half-normal saline, when a patient is dealing with hypernatremia, meaning they have way too much sodium relative to water in their ECF, or when they're suffering from severe cellular dehydration. The cells literally just need a big drink of water. However, we absolutely must emphasize the major danger here. Giving water to dehydrated cells is great, but if excessive water rushes into the cells, brain cells can swell up too. This causes cerebral edema, which is a highly critical and potentially fatal risk.
All right, Section 5, isotonic, volume replacement. Here's where we find the middle ground, the scenario of perfect balance. The prefix iso means same. So an isotonic fluid has the exact same concentration of sodium and water as your normal body fluids. So the crucial point is, because the concentration is perfectly equal on both the inside and the outside, there's no major osmotic shift pulling water in either direction.
Watch what happens in this sequence. We infuse an isotonic IV, like the super common 0.9% normal saline. The concentration just remains beautifully equal in both the ECF and the ICF. Since there's no osmotic pressure gradient dragging the water around, the fluid just stays put. It stays entirely right there in the intravascular space, inside the blood vessels.
Because this fluid stays right in the vessels, isotonic solutions like 0.9% normal saline or lactated ringers are basically the absolute gold standard when you simply need circulating volume. If a patient comes in with hypovolemia, which is a fluid volume deficit, or maybe they're experiencing severe blood loss or dropping blood pressure from losing fluids, you give them isotonic fluids. It purely boosts their blood volume and pressure without altering the cells themselves at all.
And finally, Section 6, clinical dangers and takeaways.
Let's pull back from the microscopic view of our cells for a second to look at the macro-level patient in the hospital bed. And this brilliantly illustrates a really great trick for your exams. Notice this reversal. Low sodium in the blood means a hypertonic solution might be used to pull water back out of the cells. High sodium in the blood means a hypotonic solution might be used to give those poor, dehydrated cells some free water. But, quick caveat, in the real world, you can never just use this as a blind, automatic rule. The actual severity, the patient's specific symptoms, and their overall fluid volume status are always going to dictate the final treatment.
Which brings us to our absolute golden safety rule. When a patient has hypertonic dehydration and their cells have all shriveled up, your first instinct might be to pump them full of hydrating fluids immediately. Don't. Actually, scratch that. Never do that. Rehydrating shrunken cells has to be done very, very slowly. In a clinical setting, this process can actually take up to 2 full days in the ICU. Why? Because if you infuse those hypotonic fluids too quickly, the water's going to rush back into their shrunken brain cells way too fast. That sudden cellular swelling causes severe cerebral edema, which can lead to seizures or even a coma. It is quite literally a life or death balance. So the next time you see one of those clear IV bags hanging in a room, pause for a second. Think about the incredible delicate fluid balance happening inside the human body. And ask yourself,
Where do we want the water to go?